Could you kind of compare the systems between the UK and what you see in the Caribbean at the moment? Like, what are the differences?
Well, most of it is very similar in terms of the hierarchical structure and the way that things are devolved at a trust level. They're very similar. The biggest differences, I would say, are one, the formality of it. So where let's say lower and middle income countries tend to have bigger challenges is with robust guidelines and frameworks for practice, policies, and systems of audit and service improvement, which is what the UK does very well, and where we tend to struggle a lot more. So things are less audited, and therefore, practice can vary quite a lot from place to place. On the flip side, that also means that innovation is a bit easier because you don't have as much bureaucracy that sometimes can get in the way of it. So it is often easier to go from, licensing and funding to implementation. The time frame can be shorter. But the second difference, and really the biggest difference, is the access. This is not unique to Trinidad. It's not unique to the Caribbean. Even within the Caribbean, there's such heterogeneity because of income disparities. But it's really access to therapeutics, access to diagnostics, access to clinical trials, and access to specialist support. Because if I don't know something, there are several colleagues in the same field, even within my own hospital, who I can always meet with and discuss cases with. But in places like that, you might be the only one with a specific focus in that area, and getting help easily is not straightforward. They're not unique challenges, but yeah, there are definitely big differences between what we have here and what exists in most of the world.
Yeah. So, like for example, if you in a institution in the Caribbean, like there might not necessarily be other oncologists. Is that the scenario, or would it be?
For example, if we look at the Caribbean as a whole, in some of the territories, some of the smaller island states, they may not have any oncologists at all, and they may have to get help from larger islands or larger states nearby, just to provide that sort of support. Some of them may just have one, and so there is that heterogeneity. And if we're looking at the whole Caribbean, you have very small islands with 40,000, 50,000 people, but you also have very large territories like Guyana, which is larger than the UK, but has 800,000 people, and they're spread all over the Amazon, etc. And trying to bridge that sort of gap and provide care to places that might need a few hours by helicopter to reach. The challenges are quite wide if we look at the Caribbean as a whole. So getting cancer care to those people, it is a challenge. There's a lot of work being done, but the challenges are very different to what we face here.